All right. Well, hello, everyone. My name is Maggie Keen. I'm the Vice President over here at myCNAjobs. So excited today to be joined by both of these lovely ladies, Laura Ellen Christian, the Vice President of Client Engagement at AGE-u-cate, and Jessica Fairbanks, owner and care manager at Home Care Assistance in Iowa. So excited for the folks that are logging in to join us here today for what I think is a really powerful conversation. Today is World Alzheimer's Day, so I know Laura Ellen, we're focused on that as sort of a tenet of today's discussion, and you're going to be bringing some really interesting insights today around both finding recruitment and business success with dementia care training. And so looking forward to today's discussion. Here's kind of what to expect from our conversation. So to start a little bit on why we're here. So what we're seeing from our corner of the world, from a recruitment standpoint, what we're seeing job seekers and caregivers are looking for today. Then we're going to dive a little bit more in depth with Laura Ellen on why dementia care training is so important, how you can create quality dementia care training programs, and then how do you leverage that to retain your staff. And probably the part I'm the most excited for, Jessica, maybe I'm a little biased, but is having a live chat with you from a provider perspective. It's great to hear from Laura Ellen and I sharing data and insights and trends that we're seeing in the market, but probably the most powerful to hear from someone who's actually doing this today. So we're going to be diving in there, leaving plenty of time there for that conversation. And then we'll open it up to open Q&A, additional resources. Both Laura Ellen and myself and our teams have some guides, tools, downloads as well that we can connect you with. So Laura Ellen and Jessica, if you guys want to turn off your camera, I'll go ahead and dive into the data here. So to start today's conversation, why are we here, right? Well, dementia care, we recently ran a survey. Hundreds of home care agencies across the country responded, and we asked them, what are you looking to learn more about? What are topics that are interesting to you? Overwhelmingly, dementia care and dementia care training is one of the top requested topics by both caregivers and by agencies, which is fascinating. Agencies want to know how to support dementia care patients. They also want to know how to set their caregivers, how to set their staff up for success. So we're both hearing this on both sides of the aisle, right? We're hearing this both from job seekers and we're hearing this from agency owners, from recruiters. We also know, and we're going to share some specific data here in just a minute, but we know that caregivers need to be learning, they need to be growing to stay and build a career with a company. Our research shows this, research across many industries shows this here today. So we're going to dive a little bit more into that. We know the power of training as a tool in both recruitment and in retention. And then last but certainly not least, we're seeing more Americans needing dementia care training than ever before, dementia care services. And so Laura Ellen is going to talk a little bit more about that and give you some data and insight there. But unfortunately, the need for this type of care is growing in our country. So from a training perspective, there's sort of two schools of thought, and we're seeing some shifts in our industry here today across the senior care industry. But there's sort of the idea of training for compliance, right? Training to check a box, training because we have to have this to meet state requirements or payer requirements. And then there's the other side, which is training for growth and training for development. And openly, for too long, companies in many industries, including our own, have focused on training for compliance. That's their sole focus. But today, we're not just talking about compliance, right? The bare minimum that you need to meet those state requirements. We're talking about how you can use training to develop career paths, how you can use training, specifically dementia care training, to invest in your caregivers, and really to elevate your team across the board. For those of you who aren't familiar with myCNAjobs, we do ongoing research and data collection into why job seekers are choosing to work one place and not someplace else. What's motivating them to stay in our industry? What might be motivating them to leave our industry? The desire to learn and grow has been a consistent theme in our research over the past decade. And we know that caregivers are challenged, right, in paying for training. They often can't afford it. But we see this big disconnect in our industry. We asked caregivers how frequently they would attend free training if it was to learn new skills, if it was offered. And we asked agencies how often they are actually offering this. So 72% of caregivers are interested in monthly training opportunities. They're interested in consistent training opportunities. Meanwhile, 24% of agencies are offering frequent training, right? So there's definitely a bit of a divide here, and this is a great opportunity as we're building on today's conversation for you to try to engage your team. We also see that 79% of caregivers say they want to learn and grow in their career this year. We've seen a really big shift in our industry. We're seeing caregivers wanting to work for one employer full-time for one company with benefits. We're seeing employers wanting to go, or caregivers wanting to go someplace and hang their hat with an employer. These are big shifts in home care and in senior care. We also are seeing this year that 40% of caregivers indicate their biggest career goal this year is to get more education and gain more skills. It's a big portion of our industry that's saying that today. We also see the benefits of investing in training. So 85% of caregivers want more paid training opportunities. 44% of workers cite a lack of training as the reason that they left their last job, right? So it's not just about attracting people, but it's also about keeping people and retaining them, right? Virtually every employer has some form of training, even if it's just new hire orientation or basic training, but this is something that we're seeing across the board. 71% of caregivers say they must be learning to stay with the company. So businesses that are embracing training as a tool, both for employee empowerment and engagement, will be able to remain competitive as the demand for caregivers and CNAs continues to rise. We look at motivations for becoming a caregiver. And so in a survey, we looked at, why did you become a caregiver? What was your reason for getting into this industry? The desire to help people is overwhelming. They have folks that are experienced or have cared in the past for elderly or disabled loved ones. But one of the top reasons is to learn. A lot of folks are planning a career in nursing or planning a career in healthcare. 73% saying that's their big reason, their big motivation for becoming a caregiver. Along these same lines, we surveyed caregivers and found out what topics they were interested in learning more about, where they needed support. And here is what they said. These are the top 10 areas that they highlighted. You can see one of the top ones on here, Alzheimer's and Dementia care training. They're looking for that training. And I know that AGE-u-cate has got some great resources, great training modules here as well. We're going to talk a little bit more about that, but you can see end of life care. You can see how to learn from other caregivers like them, which is kind of interesting. A few on here that I thought were interesting were, how to address patient feedback or denial, end of life care, right? So some things we're seeing there. This is continuing to shift with the pandemic, right? We're seeing folks looking for training on safety precautions, those being kind of top conversations that we're having with caregivers right now. Now, a few years ago, 2 years ago, we ran a survey, and 55% of agencies reported that they would hire caregivers without experience. 45% said that past experience was a must. I bring that up. So 55 and 45 is now 76 and 24. We are now seeing a massive shift here, right? 76% of agencies saying they will hire and train employees without experience. That's a 20% increase over what we saw just 2 years ago. I think it's worth noting that 40%, right, less than half of the market has more than a year of experience. We've seen another big shift in this over the past 18 months as well. We've got new people coming into our industry. Unfortunately, we have folks, sometimes experienced folks, leaving our industry as well. It's been a hard year for our frontline healthcare workers as well. So, it's interesting here as we look at inviting people in who don't have experience in care. It's not just about making sure they're, again, checking boxes for compliance or they're set up for that first day of work or those first 90 days. It's ensuring that they're set up for success and they have the training and support they need to be successful in that role. Otherwise, that's not someone who's going to stay on board long term. and that's not someone who's going to be a good fit for your clients, right, or your patients there. So something, again, that we're seeing for those quarter of agencies who are saying they won't hire and train folks without experience, likely a missed opportunity here. Likely these are folks who are continuing to struggle with recruitment. Last piece here, and then I'm going to pass it over to Laura Ellen to talk a little bit more in depth about dementia care training and why it's important. Training is key. This is a fundamental part of what caregivers want to focus on, not just during the interview, but it's something that they're asking about throughout their hiring process. It's something that they're asking about when they're considering which companies they do and don't want to go and work for. And it's no surprise to anyone here on the line, but they have options, right? We know that about caregivers and CNAs. They can work literally anywhere they want right now. And so we're seeing training being one of those top 8 areas that caregivers want to focus on. So you can see from the caregiver's perspective, from the job seeker perspective, we're seeing here training being at the core of what they're looking for from a recruitment and retention perspective. But now I want to bring Laura Ellen on to talk about AGE-u-cate and kind of their place in the industry, and of course, more in depth, talk about some fascinating insights and statistics on dementia care training, and what we're seeing in our country and our industry today. So Laura Ellen, I'll go ahead and pass it over to you if you want to give folks a little insight on AGE-u-cate as well. That might be helpful.
Yeah, great. Thank you, Maggie. It's great to be here with everybody. So as Maggie said, I work with a company called AGE-u-cate Training Institute, and we provide dynamic training programs and solutions for this topic, right? For people that are doing the great, important work of caring for anyone, any of our elders, but specifically those living with dementia. So I'd love to share with you some information today about that and how we can create quality programs for your organizations that really lead to outcomes. So you can go to the next slide. All right, so Maggie talked about like top 10 areas of interest for people delivering care that they're interested in. So 5 of those at least are connected to these next couple of slides. So she talked about Alzheimer's and dementia, end-of-life care, creating engaging activities, how to handle bad behaviors, we like to call them stress reactions, how to better address patient feedback or denials. So when we think about this slide here, 1 in 9 people age 65 and older have Alzheimer's type dementia. I want you to think about that in terms of your client population, right? 1 in 9 of your clients are living with Alzheimer's or dementia. And then I also want to think about Alzheimer's is only one type of dementia. So there are over 70 different types of dementia. And when you connect that to another statistic that 45% of people living with dementia report not being told of a diagnosis, you think about how much those numbers increase of clients that your staff are caring for that potentially are living with dementia, and maybe you don't know it, it's not a diagnosis on their profile sheet, maybe their families don't know it yet. So that really connects over to the next slide of, thank you, Maggie, of nearly half of all caregivers who provide help to older adults do so for someone living with Alzheimer's or another dementia. So this really leads us to make the case that education around this topic of dementia care is so, so important. And the next slide is just some other information to further solidify that, but older people living with Alzheimer's or dementia have more skilled nursing facility stays and home health care visits per year than older people. And people living with Alzheimer's or dementia make up a large portion of elders who receive adult day services and nursing home care. So again, the numbers don't lie, the case is there, it's set for us that investing in dementia training is really important for you and your organization. And the next couple of slides, Maggie already touched on a little bit, so I'll kind of go through them with a light touch. But 64% of new hires in aging services turn over within the first 6 months of employment. So if we connect that back to some things that we've already talked about, Maybe it's because of frustration that might come up as a care partner, as one of your staff members who's caring for someone and they lack the skills to do that well, right? Frustration is going to lead to burnout, and that's going to lead to turnover. And the next slide tells us that 1 in 4 nursing assistants report they are actively looking for another job. And I want to focus on the highlight call out there. The cost of replacing an employee can be upwards of 16% of the annual salary for that position. So we think about that an average caregiver makes anywhere from $26,000 to $30,000 a year. That's $4,000 to $5,000 per person that turns over in your organization that you're having to spend to replace them, okay? If you think about an organization that has 75 employees with a 45% turnover rate, that is annually $160,000 that organization is spending just replacing their staff. So what I'm going to encourage you to do is think about investing in training as saving you money, not costing you money, right? Not having an effective training program is costing you dollars, which connects to the next slide of case in point, that 95% of employees state that they would stay longer at a company if their employer invested in career development, right? So you could hang on to 95% of those, and you can take a fraction of those dollars that you're losing with turnover and invest more in your people. So the next slide again is just kind of reinforcing again some of this. States are requiring more and more training connected to people living with dementia. So suffice to say that all this data, along with states requiring it more, is clearly making the case for investing in your people through training and growth. So the next slide poses the, if you will, $160,000 question, right? Of how do you create quality dementia care training programs for your organization and for your staff? Maggie pointed out earlier, you know, training is not all created equally, and I could not agree more. So I want to share with you what I have found in the 17 years that I've spent in the senior living industry. So that's where I've spent the bulk of my career before joining AGE-u-cate in senior living, doing just this, creating quality dementia care programs for frontline staff, for all staff, if you will, in the senior living industry. So as I was setting out not too long ago to help a senior living provider relaunch training that we had paused during the pandemic, we really wanted to think about not just pulling back what we were doing, but making sure that we were connecting to our people. So we created focus groups to have conversations with people, our frontline caregivers, about what connected to them most about training experience for them, whether it was connected to that organization they were working for now or an organization in the past. And what we learned is they shared that training connected to an experience was most effective for them. So training that helped them connect to the content and connect to the person that they were caring for is what really helped that knowledge and the skill that they were learning stick. You can go to the next slide. Thank you, Maggie. So experiential training. So simply put, experiential training is learning by doing, right? So what you'll see is a picture of an example of experiential training. So this is a program called Dementia Live. It is a program that AGE-u-cate created and offers to the industry. And it's a high-packed simulation of what it might be like to live with dementia. And so when people are able to go through this experience, the result is a deeper understanding of who you are caring for, and it creates empathy that leads to change. And so training that initiates change, right, is where we begin to see a return on our investment. We want to make sure that we're investing in training that is leading somewhere, right, that is leading to change, That is leading to better outcomes for your clients. That is leading to reduced burnout for your staff. That's ultimately going to lead to reduced turnover for your organization, and higher client satisfaction, right? So we don't just want training that's checking a box. And so we found the quality of training and experiential training programs such as Dementia Live that really helps set the foundation for this. And when you tack in not only experiential training, but move to a concept called micro-learning. So that's the next slide, Maggie. So micro-learning is another key component that the focus group talked about. They talked about how they were so tired of going to hour-long presentations with a quote talking head, right? They were tired of sitting through information and having to sift through what they actually needed to take from that to be able to make change and to help them do their job better. So when you think about micro-learning, that is breaking content into chunks that build on one another. So it's presenting someone with a bit of knowledge tied to a skill, encouraging them to go out and practice that, and then come back, give them more knowledge tied to another skill that builds on their previous one, and then encouraging conversation and action on the floor, engaging with clients. So that's the premise of micro-learning. So it's breaking down the skills or the knowledge that you want someone to learn in very easy to process and easy to apply approaches. Okay. So what you'll see on the screen is something called compassionate touch, and you can go back to that. Yep, thanks, Maggie. So on the screen is an example of micro-learning module that AGE-u-cate does offer. It's called compassionate touch. And so an example is when you combine Dementia Live with this micro-learning module of compassionate touch, we're getting better engagement with our staff. So what that's doing is taking 15 or 20 minutes of a supervisor or a leader's time, putting your staff through an experience that really builds some empathy, that builds excitement, and the desire to change builds empathy. And then you quickly connect that to assigning your staff to a micro-learning module that's meant to build skill. So what compassionate touch does is encourages skill built to help with agitation, to help with care refusal, to support with end-of-life care, and to help with aggression. And those are some of the stress reactions that we often see and the symptoms we often see with people living with dementia. So they're getting this experience, they're building empathy, and they're setting the foundation for wanting to learn more. And then quickly they're going into online learning, right? Connecting into the resources we have with technology, online learning. That takes the supervisor out of it now and puts the supervisor back in conversation with your staff. So that's how they link together. Because we want to put your leader in conversation with staff versus being viewed as the talking head in the classroom, right? So not only are your staff learning something, right, that they can apply in easy to process and digest chunks, but they are now, through this process, creating more connection and feeling more support from their leaders and their supervisors, because we're encouraging the leaders to come out of the classroom and engage in one-on-one or small group conversation with their staff. So now next slide, Maggie, thank you. So combined, we get what I've just talked about, right? Boost in engagement. We're fostering practical application in the workforce. We're helping to close skill gaps for staff, which is going to increase their satisfaction, and harnessing a greater use of the common technology. Okay. So I hope all of this is resonating with you. You can go to the next slide, Maggie. I get really excited about this topic. I'm very passionate about training and sharing what I know and things that I've found that are helpful in doing the work of engaging and caring for people living with dementia with others to increase quality of life, not only for our staff, but for our residents as well. So especially important as today is World Alzheimer's Day, and I attended a webinar this morning focused on the report that has gone out about Alzheimer's. And there was a call to action on that webinar focused on training, focused on education, and really targeted to medical professionals. So I want to share that these tools that we're talking about are not just for caregivers and frontline staff. They're for me and you. They're for leaders. They're for company owners. No one should be exempt from this training, right? It's really, really important. They're also great tools for your referral partners to continue to create those relationships out in your larger community. So I wanted to insert that. I'll get off my soapbox and back to the slides, but the next slide makes the case of what Maggie was talking about a little bit of hiring for experience versus no experience, right? So 75% of the workforce in 2025 will be millennials, right? And 87% of millennials say on-the-job learning and development is important. So using this is going to help you open up access to 37% of the market that has less than a year experience, so that you can set yourself up for ongoing success in recruitment and retention. And another way that you can do that through experiential learning, through micro learning strategies, next slide, Maggie, is thinking about not only orientation, drips of training, ongoing training for your staff, but really thinking about package programs for growth. So others are keying into this. I want to share an article that just came out connected to Argentum, which is the organization that supports the senior living industry. And they have been working to create apprenticeship programs. They create apprenticeship programs for people that want to become CNAs. They have step-up programs that people that want to continue their education for dementia specialists to become a mentor, and several other things. And that article shared numbers such as, for the people participating in the Argentum apprenticeship programs, they are seeing an 85% retention rate in their program. So this is validating, right, all of the data that we're seeing, that this is important. Opportunities for growth in these programs and how you offer it in effective ways that support people in their growth and their connection to their job satisfaction is very, very important. So I know that Jessica Fairbanks, the owner and operator of Home Care Assistance, feels just as passionate as I do about this. And I want to welcome her to talk about the success that she's seeing in her organization. So welcome, Jessica. We are so glad.
Thank you, Laura Ellen.
It does, yes. So I'd love to ask you first, Jessica, just tell folks briefly how your organization is supporting staff through programs and trainings.
Yeah, so a little bit of history of me. I have been the owner of Home Care Assistance of the Cedar Valley for 4 years and got involved with AGE-u-cate about 3.5 years ago, and really wanted to be able to provide something to my employees for ongoing education and training. I feel very passionate about the dementia and Alzheimer's aspect of service, so it made sense for me to dive a little deeper. But what I loved most about this particular program was the interactive piece. You know, to your point earlier, it really is something where this is something that, you know, through the process that we use, it's something that people can kind of drop their guards of what they think they know about Alzheimer's and dementia, and they start to have those like aha moments where they say, oh my gosh, that makes sense, why my loved one left the lights on, or why an individual that I care for may have behaviors like they do. And it just, for me, seeing that like aha moment, or for family members, for them to be able to experience it and say, oh my gosh, so much is put into perspective. That is one of my favorite parts about this, having this program and being able to adapt it to each individual we work with, as well as having it as a part of our onboarding process for our caregivers.
Thank you. And you mentioned something, Jessica, that I think is important to talk about, of providing this training not only for your staff, but extending it to your families, right? The
Yes.
large group of who you're connecting it with your organization. So can you share a little bit more about how maybe you're incorporating training into your sales and marketing conversation with prospective families?
Yeah, absolutely. So if it is we do this for community resources, so it could be for facilities, it could be for our potential clients, it could be just a community outreach at our library, but we really use this. And just recently, we partnered with Dementia Friendly Iowa. So when someone does dementia friendly training, we also incorporate this as part of the interactive and virtual experience. So people get, again, that knowledge of the information, but also the interactive piece. But especially with clients, when we are meeting with them, especially if we know that their loved one has dementia, I'll identify things while I'm at the assessment or visiting with them in their homes of, oh, we could do a training within the home of Dementia Live, and it gives them that perspective again as to why maybe their loved one leaves the cabinet doors open, or why it's harder for them to get dressed and out the door for appointments. And some of the in-home challenges, we're able to adapt this training to kind of show them what really that moment in life feels like for them, whether it's 5 or 10 minutes, or depending, some families it takes a little longer with, but they really do enjoy being able to see how it works within their own loved one's home.
Thank you for sharing that. I think it's so important as, not only individual organizations, but as an industry together, right? To have ways to set ourselves up to be the experts in the field, which we are, right? And so it's great to hear that you're leveraging the programs that you're offering your staff also to the greater community, because that's just helping with brand awareness, right, for your organization. And the next time people think of a need, they're going to think of you, because you're the one that was with them, that engaged with them in such a powerful experience. So that's fantastic. Another question, so how do you feel like offering this training has helped attract caregivers to join your team? Do you feel like that same ripple effect maybe with community outreach that you're also doing that with staff that are wanting to come to join your team?
Yeah, so this is a little bit twofold. We have this as part of our onboarding process for our orientation program. So new caregivers coming in, this is something that we do right off the bat as a part of our orientation. And what it does from that aspect, it helps us identify those that are truly caregivers that have the patience, the empathy. So we use it as kind of a marker for us to identify really great caregivers for those that could work with those that are living with dementia. And then as they onboard, we kind of circle back and we'll do a training, another Dementia Live, but we'll incorporate it into more of a specific training with the client that we've matched them with, so that they can identify the things or the challenges that are happening within that person's home, to give them a little more in depth of what it looks like. So they've now had the original Dementia Live training, they've gone and worked with that specific individual, and then we circle back and we change up the task and some of the things that are incorporated into Dementia Live to really give them a better perspective of that individual client's needs and challenges.
That's great. Thank you for sharing that. And what I just jotted down is, I loved how you said how you're using this training, like experiential training, which you're using the Dementia Lab program, but you're being strategic, right, about how your engagement during that process is going, so that you are, what I heard you say, is you're matching up the skills that you're seeing in your staff with the needs of your client, right? So that's brilliant, because that's going to help reduce that frustration. It's going to help make those staff that have joined your team feel more successful. And then I heard you say, right, bringing those people back then to have more conversation about how it's going. So you can identify, okay, what are some additional needs that they might need to continue to be successful. So kudos to you for doing all that good, important work. The last question I'll have here before we bring Maggie back and get some questions from those of you listening in is, how have you found this, like what we just talked about, right? That constant communication and conversation with your staff. How do you feel like that is playing into your retention strategy? Are you seeing more people stay longer because of that level of engagement you have?
We definitely see and find that our caregivers love the interactive pieces. So whether it be Dementia Live or CPR trainings, like our in-person hands-on where you get to learn the skill as well as apply the skill, those are the ones that are most successful. You know, having just the combination of both has been very helpful in just retention. And you know, when you sit back and you watch kind of what happens during those sessions, caregivers, you see what is interesting to them, and that allows you to, if you are strategic and you watch and you listen, you can start to then feed their feeling for growth. You know, I am one that I have a passion for Alzheimer's, so I am always constantly trying to learn in that direction. But others, sometimes it's wound care, or it could be stroke. If you're listening and actively, you know, engaging with your employees, you're going to find what that next piece of the puzzle to keep them engaged and interactive is. So I think it's a matter of a combination, but I think being able to help people have the hands-on as well as the literature part, and then just listening to what really gets them motivated, what's their purpose, what's their passion, and feeding into it. I know sometimes it's scary because we think if we feed them, they'll grow and outgrow our organizations, but ultimately we want that. We want people that are having passion for what they're doing and excited about what they're doing. So,
yeah, that's right. And I would say what I also love about these, I feel like are pretty, you know, easy to implement programs, right? Experiential training programs, micro learning content, is that's a way that also you can encourage your staff to grow, right? It's not that you as leader or owner of your organization has to be the one to teach and train this. You can have train the trainer programs where you are seeing that passion and spark of your staff, and that's just yet another way to empower them. They're still serving in their roles, but they have extra responsibilities. They're creating connections with their peers, and all of that leads to staying where you are, right? Because you feel supported, creating that connection of folks.
Yeah.
Thank you, Jessica. Maggie?
You're welcome.
No, it's so helpful. I'm like nodding along here while I have my camera turned off, but no, it is fascinating to see. I mean, we've seen just a massive shift from the caregiver side of things in the past few years. Is they're looking for that training, right? They're looking for an employer like your agency who's saying, hey, come in here, experience or not, and we're going to set you up for success. We're going to create those career paths for you. This is a place you can hang your hat. You can be here for a long time. And that hasn't really necessarily been the philosophy of our industry for a really long time. So it's great to see. It warms my heart and my like head nodding over here, but it's great to see that employers are making that shift, because I think that it's a welcome shift in our industry. And again, not just training for compliance, but like you said, Jessica, right? Alzheimer's dementia training, something that's your passion and matters to you, right? Looking and seeing what's important to your caregivers. Why are they in this industry, right? And often, just like many of us, the reasons we're in this industry is because we were touched by this at some point, right, in our lives. Many reasons people start an agency or stick with and stay around senior care. And that's important to think with our job seekers as well. Many of them have hearts of gold and are in this because there's an emotional connection as well. So as we talked about motivations, why are people here, helping set them up for success and align their training with that as well. That goes a really long way. So I commend you and your team. I know Laura Ellen already said the same thing, but I will double that in making it a place of employment that people want to be a part of and that they feel invested in. I think almost especially in this last year and a half, I think a lot of companies have pushed that to the side or said, hey, like we just got to get through our day to day, right? Where this is like almost above and beyond. And, you know, you're saying, no, this is an investment we're making and it's an important thing and it's going to be a priority. So So good for you. That's awesome. Absolutely. I know I'm sure if folks have some questions, they're welcome to drop those into the chat in here. I'm going to launch a quick poll and then open it up for some more Q&A. I know folks on the line might know about myCNAjobs, but not AGE-u-cate, and vice versa. So wasn't the goal of today's conversation to dive into our tools, but if you're interested in either one of our resources, either recruiting caregivers and CNAs or learning more about AGE-u-cate's dementia care training, this is your opportunity to get connected to that. We also both have resources. So AGE-u-cate has a fantastic Dementia Live white paper that we can share as well. And we have a brand new vaccine conversation guide. We actually just released last Thursday in tandem with a webinar we hosted with Angelo Spinola. You may remember him. He's a home care labor attorney with the team at Polsinelli, talking about how do you navigate a conversation with a candidate or a caregiver who may be hesitant around the vaccine. So really neat guide. We've had hundreds of agencies access it just since it was released this last week. So if you're interested, happy to shoot that over to you as well. Free resource and guide to folks on the line. So I'll leave that open for another few seconds here. And I know there was some other great questions that you had as well, Laura Allen. I know we didn't get to all of them. I don't know if you want to pose another one of those to Jessica here while we're waiting for folks to type in some more questions.
Oh, I was on mute. Yeah, of course. So I was going to ask you, Jessica, what value do you see connected to the quality of training that you offer your staff? What, we talk about the, experiential learning and the micro learning training strategies. How much do you feel like the actual value of that plays into how you're able to deliver that to your staff?
I think it's huge because two sides. I think one aspect, the more that we invest in our caregivers and the quality of training that we provide to them, it just gives them a better leg up in the types of care that they're providing to our clients. But they also show up and they represent us differently within our community. So when we have a caregiver that's been through our training programs and they are excited about it and they, have those aha moments, they're more apt to say, oh, I know about this training, and they refer people to use us as a resource. So it's kind of two-sided because not only is it valuable for the way that our caregivers show up, but it's also valuable for our community because they're sharing about it and the experience. And then as we do community events, people are wanting to learn more and they want to have an impact with their loved ones or those that they're caring for as well without an agency. They find it valuable to learn more through that process. So it's twofold, but I think it definitely helps from a community aspect as well as the caregiver aspect.
I'm probably also obviously expect maybe a recruitment question from you. One of the questions I see here too is how do you frame this from a sales and marketing perspective when you're out trying to, bring new clients into your business? I can imagine this would be a massive value both from referral partners and new clients. I'd be curious how you frame that or how your team frames that today.
Yeah, so again, it kind of has many layers of how we use it and utilize it, but sometimes it's a conversation piece of just if I'm reaching out to assisted livings or skilled facilities as offering continued education credits for their staff. So being able to go in and offer it to their staff, it gives me that awareness and, just visibility that I may not have had otherwise. It's not just a lunch and learn. Again, it's something that they can be interactive and up and moving around with, but also, we can use it in aspects of community events. I do a lot of these trainings for our local churches. The possibilities are endless on who you can become a resource for and how you show up in community events. I did it for one of my networking groups, and next thing I know, they said, oh, can you do it for my other networking group, and can you do it for my church group? So it just kind of snowballs because they know that someone in your circle has been impacted by dementia or Alzheimer's, and having that awareness and empathy, it just brings a whole new level. And even our grocery stores and gas stations, if there's no stopping who needs to have the dementia training, because it's just a growing thing that we're going to see over the next decade. And so it's powerful.
Yeah, as Laura Ellen said, I mean, 1 in 9 people over 65, right, have Alzheimer's type dementia, which, as you know, we talked about today, is one of many kinds, right? So that are impacted whether they're diagnosed or not. So I think we're all, as you said, being touched by this. And what does that mean? How do you set both familial caregivers, which is wonderful, the different ways that you can get out into the community, and maybe when they can no longer be the one that can provide that care, you could be an interesting partner to them. So yeah, that's fascinating, Jessica. Laura, I don't know if you have any other questions. It looks like the couple that folks entered you actually already answered.
Yeah, well, I was just going to share, as I was on the webinar this morning, connected to World Alzheimer's Day, you know, they also were just sharing, again, statistics around the need for training and education. They were sharing that globally, 75% of people living with dementia go undiagnosed, and really connecting that to how undereducated our medical professionals are, particularly our doctors who are giving out the diagnosis. So a statistic they shared is 35% of clinicians feel like there is nothing that can be done once someone is diagnosed with dementia. And I think that is just such a scary and staggering statistic, and something that, you know, I get passionate about, and Jessica's talked about, of not only using the programs that you're investing in for your staff, but how you can use it just to be an advocate for our industry and an education resource for people that need this education. And it's a great, like Jessica was saying, for a lunch and learn, it's a great way to go in, and you can offer something that maybe other people aren't offering, right? You're not the talking head of the lunch and learn, you're offering an interaction and experience for people. And sometimes you're more likely to get in the door or to start those conversations when you have those good tools and resources. So not a question, but a statement.
No, but a very valuable one, especially on World Alzheimer's Day. I mean, so that was one of the pieces of our puzzle in having our conversation today, is that this is so prevalent. And I think, you know, what we've heard so much about in the last 18 months has been the pandemic, has been COVID, has been the impact. That hasn't meant, though, that any of these other challenges that our clients or potential clients or community members face have gone away, right? They haven't. So they're there right alongside the challenges that we're facing with the pandemic. And so setting our teams and our caregivers and our loved ones up for success with this is so incredibly important. So well, I think out of respect for everyone's time, no one ever gets 10 minutes back in their day, but we may give that. That's Laura Ellen, Jessica, and our gift for you today. But genuinely, Laura Ellen, you and the team at AGE-u-cate, wonderful programs, really excited to be partnered with you all, and we appreciate you coming on today on World Alzheimer's Day and sharing some of that insight and information that is so valuable. And Jessica, of course, thank you so much. As I said, my favorite part of the conversation, no offense to Laura Ellen or myself, is hearing from you as a provider, right? No, Laura's like, absolutely. So hearing from a provider and what you're doing. So thank you for all you're doing for caregivers. Thank you for all you're doing for seniors, and for investing, as Laura said, in this tools that can set both your teams and your clients up for success. So thank you for making the time to join us today and talk a little bit about your experience. We appreciate you and everything you're doing right now.
Thank you for having me.
Wonderful. Well, I hope everyone has a wonderful rest of their week here today. Thank you again from Laura Ellen and I for joining us today. Hope everyone, we will follow up with you on next steps and the tools and resources that you asked for. So have a great rest of your week, everybody. Take care.
Bye-bye.
Bye.